Hello everyone. We have today a new case which is mean a time management, a cranial nerve examinations, one of the long case that you may meet in the examinations. So you take care to follow the frame and put this in your mind before you start the examination, before you enter the room. Okay. Um, we are going through our frame as we said before. We have cranial nerve examinations. After introducing the room, wash your hands and introduce yourself and confirm patient details. Explain the examinations and gain the consent. Ask about the chaperone and ask about the pain. After that, we go through general inspection overall and for the olfactory nerve, nerve number 1, the optic nerve, cranial nerve 2, cranial nerve 3, 4, and um, and 6. Okay, we have another page, of course. So also cranial nerve 5 and the cranial nerve 7, facial, and the cranial nerve 8, vestibulocochlear, and also we have another one, cranial nerve 9 and the cranial nerve 10, glossopharyngeal and vagus, and also the accessory cranial nerve 11 and the cranial nerve 12, hypoglossal. After doing all this, thank the patient and wash your hands. This is one of the longest case that you may meet in any examinations. Okay, we have to go by details. After wash your hands, introduce yourself. My name is Dr. Good morning, good afternoon. My name is Dr. Hamza. I'm one of the surgical doctors. May I confirm your name and age? Today I have been to examine the nerves in your face, which including ask you to doing some movements and also may assess the sensations. Was that okay with you? To gain the consent and the examiner with you as a child. Before we start, do you have any pain at the moment? Okay, and after that, take a general inspections for the patient and for the surrounding of the patient, any glasses or any tricks. Okay, take sure to take a general inspection. After that, go through the olfactory nerve, cranial nerve number 1. Changes in your sense of smell. Do you have any changes in your sense of smell recently? After that, go through the optic nerve, cranial nerve number 2, by inspection firstly, and assess the visual acuity, okay, on the chart, and assess the direct and consensual papillary reflexes, assess the accommodation reflex, the color vision, assess for visual inattentions, assess the visual fields, assess the blind spot, offer to perform fundoscopy, which is important. But the most important that I circulate by this color. This is the most important if you you see the time is going quickly. Okay, you have to put this you have to do through the optic nerve examination. And also, while you read what the task is before you enter the room, you have to exclude if they ask don't examine كذا, exclude this. Okay. After that, we go through the 3 and the 4 and 6. The eye nerves. Assess the eye movements by each shape and assess corneal light reflex and perform cover test. Corneal light reflex may ask you to don't perform it. Okay. After that, we go for the trigeminal nerve, which is an important. The trigeminal nerve is is sensory components, motor components, and reflexes. Okay, in the sensory, we assess light touch sensations, assess pain perk sensations. The motor, inspect and palpate and assess. Inspect what? Inspect the temporalis, masseter, muscle twisting. Palpate masseter muscles to assess the bulk and assess the mouth opening against resistance to identify weakness في lateral tragoid muscles. And the reflexes assess the jaw jerk reflex and the corneal reflex. Okay. After that, we go through the facial nerve, ask about any changes to the sense of taste or hearing recently, and inspect the face and assess the muscles of facial expressions by could you please raise your eyebrow, could you please blow your cheek, could you please open your mouth against resistance. This is the eye. Could you please close your eyes and don't let me open it? That's related to facial expressions. After that, we go through the vestibulocochlear, perform the growth hearing assessment firstly, and perform the Rini test, Weber test, turning test. Okay, after that we have to continue about the glossopharyngeal amphibians, ask about any changes to the voice and difficult swallowing. Do you notice any changes in your voice or there is any difficulty in swallowing? Okay, and then inspect the soft palate and uvula. Could you please open your mouth for me? Put the light into the mouth of the patient. And could you please say okay, and assess the cough and assess the swallow and doing the gag reflex. After that, we go for the accessory. Assess and compare the strength of trapezius. Assess and compare strength of sternocleidomastoid muscles. Finally, the hypoglossal nerve. Inspect the tongue. Could you please stick out your tongue and notice any tongue deviations during protrusion? Could you please protrude your tongue or stick out and notice any deviations? And assess and compare the tongue strength. Could you please put your tongue against my finger over your cheek? Okay, after that, finally, we have to thank the patient. Thanks for letting me up examine you. Do you need any help? Okay, and wash your hands and go for the examiner to discuss about what are you finding in your case. This is mostly to do the cranial nerve examination quickly. Put these points in your mind according to every nerve separately. Every nerve, whatever accessory, whatever. May the stem of examination order select nerves and may take it to doing all the cranial nerves. So you have to at least put this photos and this illustration for these three papers in your mind. Keep them in your mind and keep the asking of every nerve in your mind. This will help you while introduces the room. What? Okay, so go on. By this way and this flow, you save your time. This is a case for time management. Finally, thanks for your listening. I am here to help you